Is the Ober's test, and this is for iliotibial pain or pain along the iliotibial tract, which is from the iliac region all the way to the tibia. Patient is put into the lateral decubitus position. The knee is flexed at 90 degrees, and the hip is abducted approximately 40 degrees. At this point, with the hand that is over your hip, you fully extend the hip. Ask the patient to hold the position and put some gentle downward traction on it. If the patient resists and pain is elicited, that is positive. Then ask the patient to relax and you push down. If the leg will go past midline, then it is a negative finding. If the patient, without putting pressure on the knee, cannot lower the knee toward the table, it is a positive finding for iliotibial tract problems. This next examination is called the piriformis test. Again, the patient is in the lateral decubitus position. The knee is flexed to 90 and the hip is flexed also to 45. Patient is then asked to relax, and you rotate the knee forward toward the table, stabilizing the hip with your non-examining hand. If the patient is able to touch the table or at least past the midline, then the test is negative. If the patient complains of pain in the hip region or in the low back or piriformis region, then it is a positive test. Primarily, the patients will complain of low back pain, that is a piriformis syndrome. If they complain of only pain in the mid to upper buttock region, that is consistent with a piriformis muscle strain. Test, also called the flexion, abduction, and external rotation test. The patient is put into a figure 4 position such as this, using one hand to stabilize the pelvis. Use your other hand to put some gentle downward pressure on the knee. If this is a positive test, the patient will complain of pain in the lumbar spine, in the area of the SI joint. For a hip examination, SI joint problems can be the source of the pain, and for a patient with ankylosing spondylitis, a positive finding is consistent with sacroiliitis. And this should be done bilaterally. It can be done in this fashion also, staying on the same side of the patient, doing the examination bilaterally.